recognized.
Thank you, Mr. Speaker. I yield myself such time as it may consume. I rise in strong opposition to H.R. 382, which would abruptly and irresponsibly end the COVID-19 public health emergency virtually overnight. It would require this action immediately without providing patients, hospitals, providers, and states sufficient notice to safely unwind the numerous authorities, programs, and flexibilities that have been essential to protecting Americans throughout the pandemic. Last night, the Biden administration announced that the COVID-19 public health emergency will probably end, plans to be ended on May 11, 2023. This timeline provides healthcare providers and patients with the certainty and predictability needed to responsibly wind down our COVID-19 response programs. As a result of these successful programs, as well as the historic investments made by Congress, millions of Americans have received free vaccines and tests, safe access to their doctors through telehealth appointments, and continuous health care coverage through programs such as Medicaid and CHIP. Unfortunately, Republicans are needlessly rushing forward today with a reckless plan that would jeopardize the health of millions of Americans by immediately ceasing these important response programs without advanced preparations. Now, Mr. Speaker, a pandemic of this magnitude cannot be unwound overnight. We cannot flip a switch and make COVID-19 end with a snap of a finger. If H.R. 382 becomes law, it would have disastrous consequences. It would disrupt insurance coverage for millions of vulnerable Americans by allowing states to immediately start kicking vulnerable Americans off their health care coverage without any protections. And this is deeply irresponsible and dangerous. Americans would also immediately begin paying out of pocket for the COVID-19 testing, and hospitals would see an immediate payment cut of 20% for Medicare patients with COVID-19. In addition, important waivers and flexibilities, including certain telemedicine flexibilities that providers and patients have relied on for the duration of the COVID-19 pandemic, would be terminated immediately as well. This legislation would also result in the elimination of vital tools for tracking COVID-19 outbreaks in nursing homes and other residential facilities. And it impacts our veterans, ending VA clinicians' ability to prescribe controlled substances via telehealth. This would severely impact many veterans' access to medications that they need to manage chronic pain, complex mental health conditions, and substance use disorder. The legislation also threatens the progress the VA has made in ending veterans' homelessness. And finally, Mr. Speaker, it would abruptly end flexibilities for the Supplemental Nutrition Assistance Program, or SNAP, that would impact many Americans struggling to put food on their tables, particularly for those having trouble finding work and low-income college students. Now, Republicans began their House majority with chaos and confusion earlier this month, and this bill continues that chaos and confusion, but this time it will hurt millions of Americans directly, and that's simply not right. Responsibly transitioning to the post-emergency future requires careful planning and coordination with public health officials and policymakers. I applaud the Biden administration for properly guiding the nation to a safe transition as we unwind these programs without endangering access to care and treatment for Americans. Unfortunately, Republicans are rushing to recklessly and dangerously eliminate all these protections immediately and without warning. So I just think it's the height of irresponsibility, and for that reason, I would strongly urge my colleagues to oppose this bill, and I reserve the balance of my time.